99%. We are the 99%. We are the 99%.
Cut back the 1%.
The 99%.
All right.
More than anyone lately. Bill Friedheim gets today.
So there's a breakfast inside, basically, of the healthcare insiders, of government people that are really trying to strip Brooklyn of healthcare resources. And so people are out here to say, you know, you can't exclude us, you can't leave us out in the cold like you did for this process. We're here to raise our voices and let you know that healthcare resources in Brooklyn need to stay in Brooklyn, and that we're in a healthcare crisis, and the last thing we need is more stripping of services.
About how many folks do you have out here today? Any idea?
I'd say there's about 200 people out here right now, and so it's a lively bunch. It's 7 in the morning.
I'm Beth Oram, a nurse. I used to work at St. Vincent's, another hospital that closed. And we're here from Occupy Wall Street because Wall Street is occupying healthcare. After they took our mortgages and crashed the economy, who got bailed out? Who paid for that crisis? Now Berger's group wants to do the same thing with the hospitals. They want to use our suffering as an investment opportunity. They want to make money by making private investment legal in the hospitals. They want another taxpayer bailout, and then they're going to allow investors to make a buck off the suffering of these people. They're going to reduce care, they're going to close hospitals, and they're going after the wages and benefits of these people. These hospitals are in crisis precisely because they are the most needed in those communities. And what does Berger want to do? He wants to close them down and shift services to hospitals for the healthy and the wealthy. This is ridiculous. Where the need is greatest, you shut them down. Healthcare is a human right. We need hospitals where they're most needed, not where they're most profitable. We need a single payer system. If we had a universal health insurance system, we wouldn't even be here today. So we need to stand up and we need to say with one voice, Wall Street, hands off our hospitals. Healthcare for Brooklyn, healthcare for everyone, healthcare for the 99%.
I'm sorry, I'm just here.
We have delivered excellent services to the people of Brooklyn. We will not allow him to take those services out of Brooklyn and send them on the other side of Brooklyn for those that already have health care and already have the needs that are being taken care of. Downstate Medical Center is in an area that is extremely sparse a minute. Downstate Medical Center is an area where we deal with a lot of minorities and those that cannot care for themselves. We give the care that they need. We will not tolerate Berger to come in here and tell us what to do with our hospital.
And the recommendation to close down the only mental health facility in the largest borough in this city and to have the patients to go over to Staten Island is a very disservice to the citizens of Brooklyn, because it will cause great hardship for the families, and it will certainly cause those people who need mental health services not to be able to access mental health services if they have to travel to Staten Island to do so. So we're here to tell Steve Berger that the 99% says no.
I believe we're unified here today because we know that the community should drive changes in the healthcare system. It should not be driven by Wall Street.
Thanks, Doctor. Appreciate that. My name is Phil Shipman, and today we have a spread of food, a lot of rescued bread products, bagels, bread, and the pastries that were rescued by my friends, otherwise would have gone to waste. I think you have a parallel here between you know, food and the housing crisis and healthcare. When you have systems that are for profit and not for people, you're going to get a lot of waste in the food system. You're going to get homeless people in peopless homes, and you're going to get healthcare that's for profit, not for people. And we're all going to feel the impacts of that. All these struggles are connected.
I've worked in healthcare all my life. I'm a HIV researcher. Seen funding cut for everything due to the war. Instead of helping people. Cut cutbacks. Our cleaning crews at Bellevue, because that's where my lab is. Used to be 4 cleaning people to a floor. It's a big hospital. Now they have 1 person for 2 floors. It's disgusting. People are leaving left and right through attrition. It's impossible. People come to these hospitals because they have no other choice. They have no coverage, no insurance of any kind, can't afford medicines. And instead of helping, things are getting worse. And the money is being siphoned off by people who don't give a good goddamn about anything but the dollar, but the bottom line. Money has become the final arbiter for everything in this culture. Everything depends on that dollar sign. And if the dollar signs don't come up, we lose. We lose all the time. So we have to get together and fight this. All of us. We have the numbers. We have the power. We just have to get ourselves together and show them that we have the power. Without us, they are nothing.
The people united will never be defeated. The people united will never be defeated. The people united will never